Hello, I'm Dr. Adnan. Today we will take a journey through the differential diagnosis of headache. In addition to day-to-day practice and OSCE, it will be helpful in a number of other ways. We see headaches very frequently in our day-to-day practice. There are numerous causes of headaches, but I'll concentrate on some of the most significant ones. Let's start with the history taking. Elaborate the headache first. We can remember with the mnemonic Socrates. S for sight, O for onset, whether it's sudden or gradual in onset, whether it presents all the time or comes and go. C for character, R for radiation, A for associated symptoms, T for time course, E for exacerbating and relieving factors, S for severity or scoring from grade 1 to 10. After elaboration, inquire about associated symptoms. Based on elaboration, suspect few differentials and ask associated symptoms of it. Now, past medical history, we will ask for history of previous similar conditions, diagnosed with any medical conditions, taking any medications including over-the-counter medication, any supplements or herbal medication, allergic to any medications, history of hospitalization and previous surgery, history of any family diseases. Coming to the personal history. Elaborate diet, smoking, alcohol, physical activity, stress, recreational drugs, sexual history. Ask for TOL. T for travel, O for occupation, L for living condition including housing and with whom he or she is living. Asking every question would be unnecessary in history taking. Instead, only pertinent ones should be asked. By categorizing disorders into intracranial and extracranial categories, we can recall several headache causes easily. Let's start with the intracranial first. These all causes are red flags, therefore I'm writing them in a red. First, head trauma, which can complicate it as epidural hemorrhage or subdural hemorrhage. Then subarachnoid hemorrhage, meningitis, encephalitis, space-occupying lesion. Let's now address a few important pathologies and the crucial questions we must ask. Meningitis and encephalitis. Meningitis is an infection of the meninges, the membranes that surround the brain and spinal cord. Encephalitis is inflammation of the brain itself. Symptoms of meningitis are headache, neck stiffness, photophobia, fever, confusion, nausea and vomiting, rashes or spots. Symptoms of encephalitis are headache, fever, confusion or disorientation, seizures or fits, changes in behavior, weakness or loss of movement in some part of the body, loss of consciousness. Moving to the intracranial hemorrhage. Epidural, subdural and subarachnoid hemorrhage. An epidural hemorrhage is a collection of blood that forms between the skull bone and the dura mater, which is the outermost protective membrane covering the brain. A subdural hemorrhage is a type of bleeding that often occurs outside the brain as a result of a severe head injury. It takes place when blood vessels burst between the brain and the dura mater into the subdural space. A subarachnoid hemorrhage is a type of stroke, caused by bleeding on the surface of the brain into the subarachnoid space. Let's discuss symptoms of subarachnoid hemorrhage. Sudden severe headache at the occipital area. Thunderclap in nature. Patient will complain of feeling like kicked in the head. Other symptoms include neck stiffness, nausea, vomiting, photophobia, seizures. Symptoms of space-occupying lesion. Headache, seizures, early morning nausea and vomiting. Vomiting can be projectile in nature. Behavioral changes. Paralysis on one side of the body, it's progressive in nature. Vision or speech problems. Here is a CT scan of space-occupying lesion. Moving to the extracranial causes. We can classify extracranial causes in different categories. One is vascular causes, which includes migraine, cluster headache, temporal arteritis. Another is referred pain. Related to eye, refractive error and glaucoma. Related to ears, nose and throat, like acute or chronic otitis media, mastoiditis, sinusitis, and everyone's favorite category for the viva, miscellaneous, which includes tension headache, trigeminal neuralgia, hangover headache. So these are the extracranial causes. Let's discuss extracranial causes one by one. Starting with the vascular causes. Symptoms of migraine are moderate to severe headache, normally on the one side of the head, nausea, vomiting, photophobia. If it's migraine with aura, then it includes symptoms such as seeing flashing of lights, tingling in hands and face. Symptoms of cluster headache are sharp or piercing sensation on one side of the head, which is felt around the eye, temple and face. It affects the same side for each attack. Red and watering eye, drooping and swelling of eyelid, smaller pupil in one eye, sweaty face, blocked or runny nostril. Symptoms of temporal arteritis are frequent, severe headaches, pain and tenderness over the temples, jaw pain while eating or talking, vision problems like double vision or loss of vision. Can be associated with polymyalgia rheumatica. Let's come to the very common condition. Tension headache. Symptoms: pain on both sides of head, face or neck, like something is pressing on head or being tightened around it. Band shape. Common causes of tension headache. Is it so? And what about this? Not actually. Stress. Sleep problems. Excessive caffeine intake. Let's quickly review the red flag symptoms of headache. Neck stiffness, rashes or spots, seizure, drowsiness, persistent nausea and vomiting, migraine with aura. Thanks for watching. Do like, share and subscribe to the channel. And don't forget to press the bell icon. Follow us on Instagram.